I'm a child of a former medical missionary who founded Global Health Ministry in the 80s. It's a wonderful place where people donate and it finds its way to places in need.
My earliest memories probably go back to when I was 4 or 5 years old. Here, two Global Health Ministries to the warehouse when they were packing shipping containers. I grew up in northern Tanzania, so I have distinct memories unpacking shipping containers on the other end as well.
I think my relationship with Global Health Ministries feels like it's more of a family member, just because it's such a big part of my dad's life, and therefore a part of my life.
I've spent a career working in humanitarian relief and development work, local Christian NGOs, the UN, and then the bulk of my career with the U.S. Agency for International Development.
So I'm a senior program officer at Johns Hopkins Center for Communication Programs and a Global Health Ministries board member.
Jesus treated us with kindness and compassion. That is our job, is to mimic him and to live in his image. And I truly believe that being involved is helping bring that to life.
I got exposed to the disparities that are quite severe, quite intense there. And now I've decided to pursue medicine.
Working as a nurse here in the States has shown me the huge disparity between the health care that we have access to here in this country and the lack of care in these villages that don't have the access.
So we were invited by a Lutheran diocese in Western Tanzania. They were looking for consulting support. We didn't just go and say, we've got the answers, here's the solution. There was a really good needs assessment that was done. Healthcare isn't a one-size-fits-all.
What I appreciate so much about Global Health Ministries is that there's a focus on partnerships, and knowing that an organization like this that is really down at the grassroots level gives you just a connection with the population that you're partnering with.
I'm just constantly humbled by what I thought I would be bringing to communities or to my health and what I was learning from the people there.
That's something that I really appreciated about Global Health Ministries, and what I've learned a lot and how that's shaped, my ethics, my morality, is how much more work Global Health Ministries has done to uplift those communities that it serves.
I have been fortunate to go back to visit Tanzania and Liberia and have seen the hospitals and clinics that have grown, have been able to add additional services, and a lot of that has Global Health's thumbprint on there.
There were times we would go and they didn't have enough beds or they didn't have electricity. It's exciting to now see, even a few years later, the impact that GHM has had on places like Selian. I was able to see the NICU with new isolettes and witness the equipment that has been brought in the past 20, 30 years, the technology advances, the ability to have constant electricity and running water.
Another big change as the generations have gone is an emphasis on training, an emphasis on education.
There's much more an emphasis on the primary health care, the outreach that goes all the way out to the community in a way that's preventative and supportive as well as curative.
I didn't realize the scale of GHM until really truly getting involved, and I'm blown away at the impact that is made every day around the world, and I'm honored to be even just a very small part of it.
I think when you start looking beyond your community, beyond your country, when you start thinking about things in terms of a global world, there's just so much richness to find there.
I want to do something where I feel like I'm helping others, and it's something that feels very connected to my childhood and even a little bit my sense of self.
If you can continue to serve others, other people can see that in you and continue to move that on to the next generations and the next generations.
I'm honored that I get to teach my children a servant heart and the ability to truly care for others. And I learned it from the generation before me.
I love that there are grandmas and grandpas and teachers and youth, global health professionals, missionaries. But I think it's special that it's a community here based on a common understanding and value of the communities beyond Minnesota, outside of the United States. And I think that's just a perfect example of change through generations.